Setting, oncology ward. You are talking to 50-year-old man who is terminally ill. He has been diagnosed with cancer and is scheduled to undergo chemotherapy. 1. Reassure patient and encourage him to share his feelings. 2. Tell him about the importance of undergoing chemotherapy. 3. Ask him to reconsider his decision of not having chemotherapy. 4. Tell him to give consent in front of family member. 5. Agree with him, when the patient is reluctant.
Good morning.
Good morning.
My name is Sarah. I am the charge nurse in this oncology department. Would you tell me your name, please?
Why? Why you want to know my name? Don't you have my details?
I do have the details, but just to confirm that I'm talking to the right person.
My name is John.
Thank you, Mr. John. Tell me how you have been feeling lately.
I am not interested to talk to you.
I completely understand your reluctance. I know it must be very difficult for you. It is not unusual for people to react in this way. I'm just trying to help you here. Can you tell me how you are feeling?
I am in lots of pain at the moment. I can't bear it anymore. The chemotherapy is actually killing me. So I don't know what's going to happen to me. My days are just going to end.
All your concerns are really reasonable. If I were you, I would react the same way too. Although I would like to tell you chemotherapy is the only treatment for you because chemotherapy can kill the fast-growing cells in your body.
It's just an absolute waste of time. I've been doing chemotherapy for quite some time. You just aggravate my condition. I see no sort of improvement in my condition at all. I don't see any purpose of this chemotherapy going on. So I'm ready to die at any moment.
I know how emotionally draining the situation must be for you. Please don't lose your hope. We are trying our best.
It just makes my condition worse. I'm feeling so miserable. So there's no more reason for this chemotherapy to just go ahead.
I can appreciate how difficult it is to talk about. You do have the right to decide about your treatment and we do respect your decision as well. But kindly reconsider it.
There's nothing to reconsider about. I know my fate. I don't want to talk with anyone else. I just made peace with myself.
Now, in that case, we would require a written consent as a procedure. And also, I would like to talk with your immediate family member. Is that all right?
No need to talk to them. I am the one who decides my fate. I don't want anyone else to get involved in it. I will give you whatever you need.
Thank you, Mr. John. I'll discuss with your concerned doctor and get back to you. I will be back soon. Meanwhile, if you need any help, please press the buzzer. I will be available to help you.